Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you for joining us.
Thank you very much for having me.
All right, if we can begin with yesterday's announcement by His Excellency of a bonus for health workers, could you give us a little bit more information on that?
Well, I think the workers in the health sector, they welcome the announcement by His Excellency. I think it's well deserved. As you know, they've been working very hard during this pandemic, and to get this extra 2 weeks pay is going to help. And I think everyone that I have spoken to so far is, complimenting the government and His Excellency for such a bonus. And we'll have to put the administrative measures in place to ensure that people get it in time.
All right, I know that y'all have been working very hard, as the President said, behind the scenes, because now the frontline workers it's no longer just one particular category. Could you speak on that?
Yes, what we will be doing is to ensure that all clinical staff, meaning all categories of nurses, doctors, pharmacists, laboratory technicians, and so forth, that everybody would benefit from this bonus. And one category of people who really go unrecognized for the work that they've been doing, but they come in contact with people all the time, is the cleaners at these facilities. So all of them would be able to benefit from this 2 weeks bonus.
All right. As we're on that topic, the Lenora Cottage Hospital, Diamond will be completed soon, I believe, and with that starting, could you tell us what sort of service will the hospital be offering during the time that all this upgrade is happening?
At Lenora, we will decant some of the services to nearby health centers, and some service would continue at the hospital, because how we have sorted out the construction, it would be in a phased arrangement. So when you disrupt one section, hospital can still, or some services can still continue while construction is ongoing. So they have done that in a phased way. So services would be interrupted, but people would still be able to access services, whether at the actual Lenora site or a nearby site. So that's what we're working on. In terms of what we will be doing there, we want to make the facility more climate resilient, meaning that to prevent it from being flooded, and also to make it more energy efficient. So the way that we are looking at energy efficiency is to utilize the solar panels to make sure we have a good battery bank, and that most of the appliances of the hospital would now be run using this solar energy. In addition to that, we put special systems in place for water filtration, using rainwater and filtering that so that we can ensure that we are utilizing water in the most efficient way, not wasting it. And then, of course, the layout of the facility itself. One of the challenges that we've had over the years is that we started out with one building, then we had another one, then we had another one. And sometimes over time, it becomes a clutter rather than having a more efficient flow. And recognizing this, what we want to do is to make sure that the actual buildings that we have there, you can flow from one clinic to the other. Or if you need a diagnostic test, that it's, you can access it quite readily. If you need laboratory services, that it's accessed quite readily. If you need pharmacy services, that it's accessed quite readily. So the whole retrofitting, repurposing of the building is to allow for that more efficient and smooth flow, so that patients don't have to, go through a maze to be able to get these services. And I think it would help people, to get a better service, better quality of service. And of course, our intention is to expand the amount of things that we'll be doing at the Lenora Cottage Hospital.
And following Lenora, we have a few others that will be up upgraded to the smart hospital as well.
Yes, we are also looking at Mabaruma Hospital, which we'll be retrofitting. We are looking at the Lethem Hospital, which we'll be doing the same thing. And of course, the hospital at Paramakatoy. So there are 5 hospitals that are in this particular project, and it's funded by the UK government.
Yes, sir. If I can ask you for an update in Oriel and Separuta. And following that, as we're on it, we can also speak to Bartica and St. Cuthbert Mission.
Yes, so if we start with St. Cuthbert's Mission, we are down to about 20 active cases, and we expect that we'll see a decline there.
Yeah.
So, over the weekend, we'll be able to lift the lockdown in the new week and monitor the few active cases that remain. We will continue to have a medical presence in St. Cuthbert's Mission, just to ensure that as we see the decline of this curve, that we're making sure that everybody there, that they're all right. In Region 6, we have seen that spike in Siparuta and Oriala, and we continue to monitor them. I think the village council on their own have imposed certain restrictions on travel and movement, and that can aid or limit the spread of the infection. But once you do self-isolation in the village itself, it prevents transmission from occurring. So we are going to continue to monitor that, and we have a medical presence in those communities as well. And if we see any patient that move from an asymptomatic case to a symptomatic one, then we'll be monitoring them more closely. And if there's a need, then we'll even bring them out to one of our hospital facilities where they can get additional care if that is required. So we have a system that is set up, and we will continue to do so. We noticed a little increase in cases in New Amsterdam as well, and that too is under our observation. And we'll continue to monitor, we'll continue to test persons who have been in contact with these persons who are currently active, so as to get a better picture. In Bartica, we have 65 cases. It has remained pretty much at the same level, and I expect that after a 10-day period, you will see a lot of discharges, and we should see the numbers go down in Bartica as well.
All right. If I can ask you with regards to Siparuta, just for clarity, the lockdown that's in place is not the task force that initiated that, it was the village council.
The village council, I think, in their wisdom and discussion, maybe with some of the local health officials, probably decided on that. But we did not require them to lock down the area.
Okay. Is there any particular difference between their lockdown to the task force lockdown?
We did not advise them that they need to do a lockdown. So they on their own, and I guess they have that right as a village council to make those decisions. On their own, they decided that they want to have a restriction of movement, and they have imposed that.
If I can ask you, on December 1st is World AIDS Day. So as we wrap up, could I ask you about any particular activity or any message you'd perhaps like to, say to the population?
Well, World AIDS Day is a time when we would normally reflect on our achievements over the past year and what has been accomplished in the fight against HIV, and to probably reflect and come up with new strategies of how we move forward. The United Nations had a target of 90 by 2020. And while Guyana would have achieved the first 90, we are still a far away from achieving the other two areas. But with this COVID pandemic, it has actually derailed many countries from achieving these targets. And so we'll have to redouble our efforts to ensure that we put more emphasis on achieving treatment of persons who are infected and to make sure that they are virally suppressed. And I think once we're able to accomplish that, it would be better for our patients, of course, and we'll meet our global obligations.
Okay.
We, for this particular World AIDS Day, we have come up with a number of strategies and things that we like to do. And because of the challenges that we have with the pandemic, those traditional things like doing marches and so forth to raise awareness, we will not be able to do those. Instead, what we are planning is to have a set of webinars with persons who have been affected by HIV. And those webinars include looking at transgender medicine, because that's a need. We do have a number of transgender persons who are HIV positive, and we need to have more specialized care for them. A lot of those persons, if they need that particular type of care, they'll have to go out of the country to get it. And therefore, we want to ensure that we have that capacity to provide that care. So we are initiating a series of webinars where we can talk about how to improve transgender medicine. And we are doing those consultations with the community itself. We are also looking at other vulnerable and risk community, and we'll be doing specific webinars for them to ensure that people understand the latest science regarding HIV. Another area that we'll be looking at is the introduction of a more comprehensive PrEP, that's pre-exposure prophylaxis, and the ministry would shortly release guidelines pertaining to that. Those persons who would be eligible for PrEP, and to ensure that this is properly rolled out. We believe that with a comprehensive program for PrEP, that we can prevent many infections from happening. It is estimated that we do have a lot of new infections, and PrEP is one way that we can reduce the amount of new infections for HIV. Guyana's had a partial program where we were only looking at serodiscordant couples, and we want to expand that to ensure that anyone who is at risk for HIV would have access to PrEP. So that's a new introduction, a new thing that we want to do, and we will be partnering with a number of our clinics across the country to ensure that this happens, and we'll be partnering with a number of the persons in the NGO community who would normally offer care of persons at risk and persons who have HIV. So this would be a collaborative effort, and so far, talking to different stakeholders, I think they welcome this move by the ministry.
All right, just two questions. I know we usually have funding for HIV, basically. So where would some of the fundings, if you can, with regards to rolling out PrEP, where would some of the fundings come from? And secondly, you said we achieved the first 90. Could you just briefly, which one of the 90 is that?
Yeah, so in terms of PrEP, we will roll that out with our own resources. I don't think it would increase our cost significantly. It's basically one tablet per day, and it's basically daily use. And there would be some costs for laboratory testing and so forth, which I think can be absorbed by the system. So it's not it's not a huge cost, and I think with our current program that we can add that onto our current program. In regards to the 90-90-90, it's the first one pertains to persons who have been tested and know their status. So we have been able to achieve that first one. The second one is persons who have been tested and are on treatment. And the third one is persons who are on treatment but are virally suppressed.
Okay.
So we have been able to achieve the first one, and we look forward to working to achieve the other two.
All right. Minister Anthony, again, thank you so much for speaking with us.
No problem. Thanks.
All right, well, that's it for today's COVID-19 update. We, of course, were speaking with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.